Welcome back to the Bass Capital Radio podcast. I'm your host, Blair Wallace, and today I'm here with Dr. Kuruvilla, who has been with almost 35 years now.
That's right.
The Cancer Center of Putnam. Thank you so much for joining me.
My pleasure. Thank you. Thank you for having me here.
Yes, I was honestly kind of jealous of Miss Mary Mackey, who gets your attention every week, and you guys have a great show on the radio station there. Be sure you tune in to Bass Capital Radio to catch Dr. Kuruvilla with Mary Mackey often. But I'm so glad you had the opportunity to join me on the podcast. I think it's incredible the way that you've been serving Putnam County. I'm interested, where'd you come from? How'd you end up here?
Well, I'm from India originally. My wife and I were both grew up in the same town. She will let everyone know that this year we would have been married 50 years.
Congratulations.
Thank you. Thank you. And she's been figuring out how to have an anniversary celebration, and I'm kind of hiding and hoping she'll forget, but I don't think that's going to happen.
I don't think so.
So anyways, we both grew up in India. We're from the same state, which is a state called Kerala. God's country, they call it, because it is very pretty and beautiful. But we grew up in what I would describe as the Badlands, which is the northeastern part of India, sort of like Arizona, very rocky and lots of minerals, steel factory, truck factory. My father worked as a CFO for a company that employed 70,000 people,
Wow.
Tata Motors. And the name Tata is today they sell Land Rover and Air India and pharmaceuticals and Tata Consultancy Services. It's a huge conglomerate, but a great company. So anyway, that's where I grew up and did my initial medical school there. And eventually, after finishing my undergraduate medicine in India, for postgraduate studies, we went to England in 1980.
Oh.
And I kind of stumbled on to radiation oncology. And that in itself is, I think, a funny story. Because my whole goal while I was in England was to study and prepare for the American qualifying medical exams, which are very, very tough. And so I needed a job which would give me time to study when I wasn't working. So the options were anesthesia, geriatrics, psychiatry, and this thing called radiotherapy. So anesthesia, psychiatry, and geriatrics sounded seriously boring. So I inquired about
Anesthesia literally makes you want to go to sleep.
Sleep, exactly. And so when I inquired about radiotherapy, they said it is where you have a lot of physics and mathematics. And they said it's a little difficult to get into, but you get a lot of time after hours. So when I inquired about it, I was told that typically the people who get into postgraduate radiation therapy training have to have completed some other postgraduate medical stuff. Either you have to be a postgraduate surgeon or a gynecologist or ENT surgeon, very heavily surgically oriented, or you could be a board-certified internal medicine doctor, that sort of thing. And here I was nothing. I was just a lowly intern, right? But not to be daunted, my first job was in orthopedics, of all things. And that too, because a friend of mine, when he saw that I was looking for something to bring in a paycheck, he talked to his consultants. This was in the Midlands in England, and said that he knows this friend who's a bright guy. I had him fooled. Why don't we give him a job? So they called me. So I said, I don't know anything about orthopedics. So you don't need to know.
Okay.
So what it is in every hospital, every night, someone will come in through an ER typically an older person who's tripped and fallen and broken a hip,
Bless them.
right? So they need someone to check that patient out in the ER
Mm-hmm.
and look at the x-rays and this and that. But more importantly, prepare them for surgery next day
Okay.
because they've already lost blood and they're fragile and they need to be put to sleep. So that was my job.
Okay.
Prepare them for surgery
Okay.
and make sure the anesthesiologist would be able to safely put them to sleep.
The boring guys, right?
Guys. And then in the operating room, be what I would refer to myself as the retractor. So you're kind of holding things apart while the surgeon is fooling around with the bone. Boring as heck. And you've been up all night and then you're up half the day fixing one hip after another,
Oh my gosh.
right? And then at lunchtime, I would go down to the basement where I knew there was a radiotherapy department.
Mm-hmm.
And this was in a small town in the Midlands in Derbyshire called Derby. Derby's claim to fame is they make cool pottery, as well as that's the home for Rolls-Royce.
Oh,
but
okay.
Other than that,
blend of
Derby's
pottery and Rolls-Royce.
There's nothing much going on in Derby. But the hospital was a big county hospital, the Derbyshire Royal Infirmary. And the radiation oncologist was probably the oldest radiation oncologist in the UK, Dr. John Kinsella. So every day I'd go down in my surgical scrubs, lunch break, and hobnob with Dr. Kinsella and lie through my teeth and tell him why I came all the way from India to do radiation oncology, and I was here doing orthopedics, but really wanted to spend as much time as I could with him to learn about the field. So this was a small department, no training program.
Right.
So after 6 months of this stuff, Dr. Kinsella got fed up of me, and he contacted the Royal College of Radiologists or whatever it was, and said, "Look, I'm an old guy, I need help. I want to start a training program."
Mm-hmm.
And then I didn't know all this. Then he tells me one day, "Hey, I've been authorized to open a residency program. Why don't you also apply?" So I was excited. I said, "Fantastic." So when I went for my interview and opened the door, I was kind of awed because here there were all these young British doctors and ladies in the business suits and men in their suits and boots and ties. And here I was in my scrubs, pretty messed up. And I said, "Oh my God," because these are serious looking candidates. But anyway, all those months of...
Oh, I envisioned, because I really try to put myself there, that you were going to face people in their suits, but you came in scrubs and they came in suits. Okay.
Maybe. But anyway, the bottom line is he gave me the job. He really shouldn't
You
have.
earned that job, though, I feel like. 6 months of pestering.
So. And then when I got into the field, it was fascinating because as a radiation oncologist, you have to know a little bit about cancer, and depending on the part of the body, so it could be a gynecological cancer or a throat cancer or a lung cancer or a pancreatic cancer or a brain tumor or a child, a woman, old man, young man, you better know your stuff because someone in that field is asking your opinion. So if an ENT surgeon is asking you or a gynecologist is asking you,
yeah.
why are they asking you? You better know more than they know. Otherwise, why should they be asking you?
Right.
So you never get bored in my field because every day somebody is picking up the phone and calling you and saying, "Hey, what do we do now?" Right?
The knower of all things in that area.
So it was great fun. And the training in England was super because this was in the 80s. The radiation oncologist was basically the cancer doctor. In the evening after work, I would go to the wards, they call the floor, and be the one administering the chemotherapy.
Okay.
There was no such thing as medical oncology. And so Uh, so no, I was no longer doing orthopedics, but this was a
You
full-time
were hip
business.
free,
No,
retraction
no, no,
free.
no, no longer the retractor. But it was great fun. So anyway, in the meantime, I passed my American exams, and I told the British consultants, I was very upfront that I'm here to pass American consultants. Then it's hasta la vista, baby, and off I went, and and that's also a funny story. So now I passed my exams. Now decided I wanted to do radiation therapy. Now where do I do it, and where do you actually begin?
Right.
So I found this book in the doctor's lounge in England, and it was a World Health Organization booklet or magazine on radiation oncology departments in the United States, the residency programs,
How perfect.
right? So there must have been about 100, and it had names like Albuquerque or Brown University or Stanford or Miami University of Miami, University of Florida. I had no idea where all these places were.
Right.
Right? Where the heck is Missouri?
Yeah.
or, or Chicago or Kentucky? No idea. So it had the name, address, program director.
Okay.
So then I went to the hospital's department secretary, and I asked the lady, very proper British woman, very sweet, can I get your help to help me with this letter? So I'd written out and scrawled out this letter. And she said, no problem, Dr. Kuruvilla. Then I said, the problem is there's not one letter, there are 100 letters, right? So I was envisioning she having to type out the address. So she
Right.
said, we'll use a word processor. I said, what's a word processor? This is back in 1980, right?
Oh my goodness.
82 or something. So I had no idea what Microsoft Word was, or even if it was then. But she did this beautiful letter and in 1 second changed the address for everyone.
Oh, that's
And
beautiful.
then mailed the whole lot off.
She should have
and-
faked it. She should have made you think that she had typed out every single one by hand.
I would have believed her. So then I gave a copy of that, sent it to my aunt, who happened to be a pathologist, and said, hey, just for your information, I've sent this out. I'm hoping somebody would nibble and offer me a program. And then my aunt took the letter to a Korean friend of hers who she was studied with.
Mm-hmm.
She knew her husband was a radiation oncologist and said, can you show this to your husband? So husband, Dr. Son, took it to his program director, his chief in Brooklyn, Dr. Marvin Rothman, professor actually. And Rothman looks at my letter, and Americans are enamored by anything British. So he
Somebody
said,
told on us.
yeah, so he said, bring the boy, right? That's me. So Son goes home very smug, tells his wife, I did it, tell your friend, my aunt was called Sarah, that they want to interview him. So my aunt calls me. So I'm so excited because this happened, I just sent for fun, sent the
Right.
letter to my aunt just for informational purposes. So before any of my real letters came
Mhm.
back, I'd already got an offer to come for an interview. So I told my British consultants, I was so excited. So I left England during a blizzard, I remember. My wife wasn't too happy. But anyway, so
50 years she must have forgiven you.
yeah, I think so, maybe. So anyway, so I got the job, but it was quite the trip.
Yeah.
So after that, so after 5 years of 4 years of training, or 4 or 5, I forget, in New York, now I'd actually had half a training in England, full training in America, was board certified, and Dr. Rothman, who was a great guy, said, now what do you want to do? So I said, I really don't know. He said, why don't you stay here, become a academic, you can stay on in the department as a. So I said, Dr. Rothman, I love you like a father, which I did. But also said, you're a mean old guy. There's no way in heck I'm going to work for you. So he laughed. He really was a good man. So he said, go to Syracuse, his friend Sagerman. So I went home proudly and told my wife, we're going to Syracuse. So she said, you're going to Syracuse. I'm not. Because Syracuse can be a little cold, I'm told. So that was that. So I went back next day to Dr. Rothman and said, Syracuse won't work. So he said, then go work with my friend Bob Kagan in Los Angeles. So I went back home. How about LA? So that Madam liked.
Uh-huh.
So then we ended up in LA for 5 years. And that was a phenomenal experience. And then I wanted to get into private practice. And I heard this group that I finally joined was opening a center in Palatka. So who knows where Palatka is? They said near Jacksonville. So who knows where Jacksonville is,
Right,
right?
right.
So anyway, so I came for the interview and got the job, and that was 1991. And they were building the center. When they drove me around, there was framing going up. So I worked for the first 6 months till the construction was over in St. Augustine
Okay.
at our facility there. So it's been
You've been
quite
all
the
over
trip.
the world with medicine.
Great fun.
Oh my goodness.
Yeah. So when people ask me, when did you train? So I think about it a second. Then I finished high school in 1968, right? Woodstock was the next year, 50th anniversary of Woodstock, by the way.
Oh,
Woodstock
the
was
good
59.
one.
Yeah, yeah. So would love to have been here for that. And
We're lucky we got you in medicine.
yeah, I don't know if a little sojourn in Bethel, New York wouldn't hurt anybody. So, anyways, yeah, it's been quite the trip.
Well, I'd say so. You got quite a eclectic mix of places that you've been, and yeah, I gotta understand you. I'm sure over the past almost 35 years have seen a lot of stuff, and for you to, my understanding is sometimes doctors will change career paths, but what's kept you in oncology?
Well, as I said, you never get bored,
Mm-hmm.
right? And I tend to be extraordinarily busy, which I enjoy. I mean, I don't mind that. But once I'm done, when I leave my office, typically 7:30 is the typical time, or 7:45. My desk is clean, and I typically start work at 9. By the time I get back to work, my staff have been there since 8. That desk will be piled up with stuff already, right?
They bring you gifts.
And the schedule is typically chock-a-block full. And I have a rule that when someone refers a patient, my rule to my staff is we need to see that patient the same day or the next day,
Wow.
right? There's no, and they,
The same day or the next day?
next day,
That is
right?
unheard of.
It is. Now, that's not feasible. Now, today, for instance, that rule is broken because today, Fridays is the day that I check on my patients who are actually on treatment.
Right.
So once a week, I spend time and ask them, are they doing good? And they can ask any day, but Friday is their day. They come with the village, each one, and address everybody's questions and make sure they're all doing okay. So Fridays, I discourage seeing patients because I want to be focused on the people on treatment, unless someone really needs to be seen. So the other rule is, so Dr. Charlie Douglas says, could you please see Laura? And if Charlie calls, he's asked, do you want to speak to Dr. Kuruvilla? Or if Charlie's secretary calls, and of course I will speak to him or her. And but I need to see the paper that so-and-so is coming. We got the call at such and such a time.
Right.
And we've scheduled the patient at such and such a time and date. So I'm making sure that I'm looking is that rule being kept, right?
Okay, so that's a hard rule.
So just to make sure that no one is cheating, right?
Right.
Now, the trouble with that is you don't have a fixed schedule.
Mm-hmm.
So my wife has been coming to my office recently, and she says, you make your patients wait a long time. And that's true. But if I'm going to shoehorn in somebody, something has got to give, right?
Right.
And so, and then there are times, or most times, it takes me 10 seconds to figure out what's going on, but it takes me 45 minutes to explain to the patient and family what's going on
Right.
and what needs to be done.
That's a very fragile
And
time.
so it takes time. Got to So she's, what
You want
did
me
she
to get you
say?
some water?
No, no, I'm good.
Okay.
So Sheila the other day asked me if I knew what SWOT was, right? So she's throwing management terms at me. So strength, weaknesses,
Yes,
blah, blah,
yeah.
blah. So she says, I've done a
SWOT
SWOT
analysis.
analysis
Oh my
and
gosh,
she's going to
Miss
fix
Sheila.
this. So this I want to see.
Oh, I love her so much. If you have not had the pleasure of meeting his lovely wife, Miss Sheila, she is a beacon of light, but she does keep you in line, or tries to at least. A SWOT analysis. That's
L-
beautiful.
Live in fear of the woman.
But she's pretty awesome though. Good to
Yeah,
have her
she
around,
is.
right? And
Yep.
she's fantastic. We are neighbors, and she has a great green thumb. So
Oh, yes,
at
my
least
goodness.
some time is occupied in the garden. You know, you're
Yes,
not always
yes.
there. So I think that's so remarkable. And we were talking a little bit beforehand. I think it's very interesting to discuss. So 1 to 2 days getting in anywhere, and granted, you know, we the people understand that we're going to the doctor, we're going to wait, because that, you know, you don't know what's going on in that next room. I think that's kind of an expectation, but to be able to get in within, even if it's 3 days, I made an eye appointment. And I have a fantastic eye doctor, and I made an eye appointment, and it was 3 months before I got in there. And my vision is not, you know, these glasses aren't strong enough, even if I wanted them to be. But
Right. And that bothers me. Like just yesterday, so typically in Putnam County, I have the trust of the physicians. So they generally call me when they think a person has cancer. And I encourage that. I really don't want them to play doctor, do tests, nothing. Let me deal with it right away, right?
right,
And so I get calls from the ER, from various groups, doctors' offices. And in fact, anyone is allowed to make a referral. So I need to make that point. So some of the barriers for care is you need to have a doctor typically to refer you to somebody.
yes,
So what happens if you don't have a doctor and you have a problem? Then you're kind of a bit of a jam, aren't you? And so not only can you yourself call, your friendly neighbor can call, right? Now we will screen that call. Somebody will come and tell me that, so and so wants to be seen. And I'll hear the story. And if I have a whiff that this may be something of concern, we'll bring that person in.
oh my gosh,
And I discourage this but just yesterday I got 2 calls from different parts of St. Johns County. Uninsured patients, one lady with breast cancer, I forget what the other person was. And they start the call, Dr. Kuruvilla, we have an uninsured patient from St. Johns County. We know you don't like to see out-of-county people, but I know they're desperate, right?
right,
Either because for whatever reasons, their own community doctors won't deal with the problem. I'm just turning off my phone. Um, um, so we do that. So the nice thing is, if I see someone who's got a problem and then I pick up the phone and call the relevant person, they take my call very seriously, right? They know me, that I
right,
wouldn't be calling and wasting their time. And then physicians typically don't care if a patient is insured or not insured. It's their organizations behind them that have a conniption, right?
right.
But doctors will find some way to sneak a patient in and do the needful. So that's cool. That's a nice thing about people, right?
Yeah,
Yeah, we have a good
that is a big
network.
fear, because there are
Yeah,
a lot of people.
yeah,
I mean, insurance is, whew,
terrible. It's
it's
completely out of hand.
better to pay out of pocket most times than it is
But if
to
you don't
go
have
through an
anything to pay, what
insurance.
are you supposed to do, right?
Exactly,
So it's just a
exactly.
mess. But anyway, let's not go there.
We derail on that
Friday
conversation.
morning has just started.
Yeah. So, all that being said, you know, I feel like with your sense of urgency getting them in, yeah, and that you have reserved Fridays to see them, what are some things that, so I get referred to Dr. K, right? We're in there. What are some things that we can expect once, if we were a patient coming to see you?
So another thing I do is I tell my staff, don't waste time telling me that we delayed seeing this patient because we were waiting to get records, right? Don't waste your time doing all that. So if the person comes in, they will take a preliminary story, what medications are you taking, what are your allergies, who are your doctors, if you don't have insurance, great, where do you work, that sort of stuff. Do you smoke and other medical problems and things like that. So, and someone would have done some imaging usually. And sometimes they will bring the images with them, or sometimes they'll bring a report, or they will just say, right? Then it's very easy for me to call whichever Flagler Hospital or St. Augustine Imaging or Middleburg, wherever it is, or UF, and say, hey, this person was in ER and you took this image, can you tell me what it was?
Right.
And generally, you'll get that. You may have to send a release sometimes, but within a few minutes, they get a fax in the hand with the permission to talk. And then I quickly assess what's going on. Then I ask the patient, so what exactly was your problem? And I discourage them telling me, I think I have anemia, or I think I have this or that. I said, tell me what your problem is. Are you weak? Are you dizzy? Are you having pain? So I get a sense of what is their complaint.
Right.
And correlate that with what they have. And then if there's no diagnosis, figure out, yep, this thing looks like it is a malignancy. Who do I need to send this patient to get a diagnosis? Is it going to be an imaging process? Is it going to be a surgeon? Is it going to be a gynecologist, urologist, ENT, whatnot, right? And once I get that feel, then I start instructing my staff. You call this, you call that, and get me to talk to whoever, find out who's available to do the procedure, and gather all the imaging then, and whatever reports we have, send the village, that's the people who come with the patient, depute them in different directions. You do this, you do that.
Right.
And within a week to 10 days, they come back. Now we have a biopsy. Now we have more imaging if I ordered it. And we have a better feel for what's going on.
Right.
Yep, there is a cancer here. What needs to be done next? What other imaging, what other specialist needs to be pulled in, right? And again, it's not uncommon for me sometimes to send a patient to our hospital for an X-ray, but in Putnam we have not only the hospital imaging, we have Putnam radiology, we have express imaging.
Yeah.
So whoever is good at that particular thing and who's got the quickest availability.
And you form relationships to know.
Right, totally. So everybody's on the cell phone.
Right.
And then, so very rapidly go to the next level. Now we have established cancer.
Okay.
Now we do what we call staging. How extensive is it? So that may require a patient to be seen by a gynecological oncologist. If it is a lady who's got a bleeding problem from her pelvis, let's put it that way. So not only does she need to be examined, you would have to do the relevant imaging, CT, PET scan, MRI, whatnot, have the gynecological oncologist put in his or her two-bit worth, right?
Okay.
If it is a urological problem, a urologist. If it is a ENT problem, a cancer.
So it's a collective effort.
So whoever the relevant specialist is, right? Pulmonologist or a specialized pulmonologist, neurosurgeon, whatever it may be. Get all these jokers involved, right? And again, no 3-month waits. Now I'm calling and saying, listen, I need you to please see this patient now, right?
Right.
Now it doesn't have to be 2 days, but better be that week, right?
Right.
Because not only do I want you to see the patient, I want you to do the procedure, right?
Right.
I really don't care how busy you are. It breaks my heart. You got to get this person in quick, right? So that has been established. So we got all the players playing,
Right.
right? So, so it's what we refer to as a multidisciplinary effort. All the doctors who are involved. So it may be the, and you keep the primary care physician in the loop,
Right.
right? So it may be a general surgeon, it may be a specialized surgeon, it may be a medical oncologist, it may be some type of radiologist, definitely get the pathologist involved. So each patient leaves the office eventually with a plan of care
Okay.
that says, on this day, you're going to go for a PET scan. On this day, you're going to go get this done. On this day, you're going to get this done. And they go with that plan of care to every other doctor. So one of those fools breaks a leg. Again, they need to get someone rescheduled to see the patient and not put it on a day there's another
Right.
conflict. So
Right.
that, right? So there's a lot of that kind of micromanagement that is necessary. If you don't micromanage, there's chaos, right? So this is just one patient, right? So in a day, if you see 5 patients, you can imagine that's 25, 30 interactions, and the poor staff are walking around with, what is that thing, deer in the headlight look?
Yeah. Yeah.
Right?
Yeah.
Right. And the poor patients are walking around with that.
Right.
And it is very overwhelming for everybody. But again, breaks my heart, be overwhelmed. But this is what needs to happen quickly, right? So, and God forbid the patient doesn't have insurance, but because that adds an extra
Layer of.
couple of extra layers of challenge, right?
Right.
So, so we are very good at that. We are very, very, very good at that. We can not only get the patients in quickly, and the reason I do that is I know all of this has to happen, right?
Right.
So if you're going to take 2 weeks to see the patient, forget months,
Right.
then you're already behind the eighth ball order. It's
Right.
called,
Right.
right? So
'Cause things can be real aggressive real quick.
it
Right.
is. It is. It's good. So I will tell you, we are very good at this. I know because I'm now probably the oldest practicing oncologist, at least a
Are
radiation
you the grumpy
oncologist.
old man now?
I am the grumpy old man. Take pride in that. I love being the grumpy old man. I want to be known as the mean doctor. It's
The
very
mean
easy.
doctor.
So because you have to crack the whip, otherwise it's not going to. You can be nice later. Right now, you got to
Right.
get the job done.
Right.
And so we're good. We're
My
good at
kids need to watch this. I gotta be Dr. K at home.
that.
So
Anyways,
just thinking about the fact that, like, if I, heaven forbid, found myself in a position where I thought or was told that I had, cancer, I would want to be your patient. I mean, just to think about, I don't think that there's really, I mean, my daughter's had to have a specialty surgery. My son's a cardiac patient. Not, we've got health issues that have been in the family. And the time that it takes us to get an appointment, get all the paperwork, get all that done, and actually get in to be seen, you've got an entire care plan for a patient, and probably half that time, really. And the importance of getting on the phone and being aggressive with people. We got to do this because time is of the essence, and that's, I mean, to have a doctor advocate at that level. And I have not, I've met some of your staff, but it's been brief. But hat tip to them for dealing with all that chaos.
yes,
Yeah.
I'm blessed. I've got very good staff, and cannot do this without a great team.
Right.
So we are just going to improve it even more. I'm in the process of dissociating myself from the current management. I've been partnering with HCA for the last several years, and they're a great people, great organization, but they're probably good at managing hospitals, but they don't know how to manage a cancer center doctor's office.
Right.
It's a completely different mindset you have to have. So we are assembling a new team. It's going to be Kuruvilla Oncology. So I'm excited about that. And it is difficult to, one drawback about in Putnam County is we don't have people with the required technological skills, right?
Okay.
And uh, and so I don't like that I have to hire people who come from A, B, C, D place
Right.
uh, because you train them up and then they want to leave because they don't want to
Mm,
drive, right?
yeah.
So I try whenever I can, when I do a new hire, I try and encourage them to live in the county, right? It's difficult. You can't be too choosy about that. You got to take what you get, right?
Right.
I was just interviewing a young man from the land, and he's excited about wanting to join, but I'm kind of cringing. He's going to be having to drive
I hate
50
driving.
minutes every day,
Right.
twice a day. That's no fun. How is he going to do that forever?
Some
Right?
people don't mind that. I live 3 minutes away from where I have to work, and I'm like, can I just be closer? Just walk out the door. Let me
Right,
live
right.
upstairs. But
So,
50
so
minutes.
these are some of the interesting challenges. But
But I love that you're mindful of that. Like, you're first of all, it gives our community an opportunity to be part of something that matters to their own community. A and B, that you recognize that when you invest in talent, which is what you're doing, we want to retain that, and not lose that to elsewhere.
sure.
And you're recruiting people to live in Putnam. You're just like the
So,
champion over here.
so yeah. So we have. I'm really excited about this aspect because now I'm finding that, and my wife is helping, that someone needs to make sure that the fire extinguishers are working, or someone needs to make sure that the linen is, we got a contract, someone is bringing in fresh gowns every day,
Right.
and establishing relationships with Staples to get the paper clips and the,
Right.
uh, and, we are trying to, we've got excellent equipment and very expensive. So I'll grumble a bit, but just as service contracts to keep all the equipment
Yeah.
upgraded is I think a $750,000 exercise over the next 5 years. That's that's scary. Uh, and but what we're going to get for that is the latest and greatest software that'll do this and do that. It's very cool.
Right.
But to implement that is about $75,000 exercise in just electrical stuff
Oh my gosh.
to handle the new servers and the new IT. And they're talking about stuff I haven't the foggiest idea. Cisco switches and all kinds of stuff. So
Routers
and way
Ethernet
beyond.
cables.
And so I'm blessed. I have friends who are in the IT field in this specialty who are pitching in to help me. And I'd be dead without them.
Right.
But this is in every aspect. You got to have, I'm blessed. I don't want to embarrass the CPA, but we have local CPAs helping us. And, the county is phenomenal. If we have a problem, we call the county and even the Department of Health, the state, to get all the licensing changed. We've just put in a CT scanner, and that one would imagine is easy, but so the CT scanner comes installed, switched on, and everything is in French. So I said, what the heck is this? So they had purchased this unit from France,
Oh, we.
right? And now he's scrambling. I think the English language keyboard showed up yesterday. So my IT people have to go in and configure everything from French to English.
Ah,
It's not exactly a personal computer you're talking about. You're talking
no,
about
I can
a
imagine.
very sophisticated machine. So every second there's some new fun thing going on.
Yeah, yeah, that sounds like an adventure. And it sounds like you've got your own village that has really
Yes.
come together because
Yeah.
you have served our community. Tell me about the Putnam First Cancer Fund.
Very proud of that. So we formed that entity 2014. So when I first came to Palatka, I had never worked in a private practice setting, right?
Okay.
Because I've always worked for teaching hospitals, Kaiser Permanente, huge organization behind you in California. But suddenly I realized you're the chief bottle washer and everything, right? And the American Cancer Society, I was told, was pulling out of Putnam County. For whatever reason, they had fallen from grace. So I contacted them, and I actually encouraged them to stay
Mm-hmm.
and gave them space to work out of our office. And they're a good organization, but what I realized after working with them for several years is the money they raise does not stay in the county, and not a cent, not 1 cent,
Wow.
right? And that's why they were being pushed out before I came.
Ah,
And then I didn't know that,
right.
but I'm slow and stupid. It took me 10 years to figure that out. So we bounced them. And the community then came together and formed the Putnam First Cancer Fund. That name was suggested by Reverend Carl Flagg. So I asked him, what should we call it? He said, since it's going to be for Putnam, it's Putnam First,
Right.
right? And so the way it's designed is to make it easy. Anybody could refer a patient, right? That's the
Right.
problem, as I mentioned earlier,
Yeah, yeah, yeah.
that you got to make access idiot proof, right? And the only
That's a bold statement.
the only qualification for assistance is that the person needs to be a resident of Putnam County. That's it. And we roped in the Palatka Christian Service Center to do that screening for us. So if you come and tell me you live in Putnam County, how the heck do I know that, right?
Right, right.
So someone vets you and says, yep, Laura is a Putnam County resident. And we now have had to get into the fundraising game because every patient encounter tends to be expensive. What was I reading yesterday? I'd seen a lady who needed a special type of breast biopsy that is not done in our community. Send her to Gainesville. So the mammograms had to be sent to Gainesville, get confirmation from those radiologists, yes, they would do it. So we are paying that bill. So the question yesterday I was asked, are they going to biopsy one area in the breast or more than one area? How the heck am I supposed to know?
Right.
So I still asked the radiologist. So he said probably one. So I said probably one. So the letter has gone out. So that exercise is I believe it was a $2,100 exercise, right?
Oh my gosh.
And that's fine. So once we establish the diagnosis, if this patient indeed does have cancer,
Right.
I believe she's otherwise, so she's probably uninsured as I think about it, because why are we paying for this? So then we would have to help her get insurance, which is another saga,
Right.
get her in to see the surgeon to deal with the cancer,
Right.
and the surgeon, myself, and the medical oncologist will decide, can this lady, and I believe we can in this instance, if it is cancer, she does not have to lose her breast. But so the charity won't pay for the treatment. But by this point, if we have established a cancer diagnosis,
Right.
we would then fall on the state and say, help, help, help. And generally they come through, right? So help the lady with a payer source
Right.
to get the treatment she needs, right?
Right.
So, so to answer your question about the Putnam First Cancer Fund, every patient we see, like this lady I'm talking about, I saw her, assess this, what needs to be done, found out how much it's going to cost. The email was sent out yesterday to the 12 members in the executive committee saying, this is a story, no names. This is what the lady needs. This is what we found out it's going to cost. Are you guys good with this? Generally, no one will quibble and they say
Right.
they're good. So once we get 6 out of 14 or something like that, or 12, that's authorized. So every 6 months, we have a group of trustees, 10 people who audit what is going on,
Right.
right? And so far, I think yesterday's patient was PFCF. Actually, yesterday I happened to see a migrant worker. I just saw her yesterday. What was her problem? Oh dear. Come to me in a second. But she needs assistance.
Uh-huh.
And we have not got to the point to figure out how much it's going to cost. But an email will go out. And now, migrant people, we can't pay for treatment. Meaning the state is not going to help.
Correct.
But at least we can establish a diagnosis
Yeah.
before it gets completely out of hand. And but the majority of people, every year we probably last year served about 150 people or 100,
Oh my
something along
gosh.
those lines.
Oh my
And
gosh.
uh, there may be 2 or 3 migrant workers in that lot. But everybody else, that exercise is easily 160 grand cost,
Yeah.
right? And it's expensive. So our fundraisers are the golf tournament and the gala.
The golf tournament and the gala.
Gala. One is in mid-October, others in early November. And we really need sponsors to facilitate that. And I will say we are the only such program that I know of anywhere, right? That no one else takes this level of care. So the Cancer Society doesn't do anything along these lines, right?
Right.
So we will, if for a needy patient, we will pay while they're undergoing care to assist them for their groceries, for their gas cards. Sometimes we arrange for people to pick them up and take them for appointments. We will arrange for sitting services, meaning somebody will sit in the house, help them feed, utilities, aside from the tests that can be expensive. So it is really a cool program we've got.
That's
Yeah.
cool is an understatement. Like just
Yeah.
really like as we talk about, Putnam County and that is the whole focus of the podcast. And if I could think of anything that really has loved and embraced Putnam County, I mean, it is this. So you come in, you are serving, and even to the point where you're branching off to know that you're doing the right thing for the patient. But we have an advocate here who, with one of the most devastating moments in someone's life, to hear that they have cancer, they have the biggest quarterback cheerleader, all of them. I mean, you're cheerleader with the quarterback outfit on, or vice versa, in there championing for them, and a whole team of staff that supports you. And then let's say that there was a circumstance where they needed help. Now this Putnam First Cancer Fund that really takes care of those in Putnam County specifically. I mean, that's just incredible. And I feel like if you have the opportunity to go out, if you're watching this, and to support, yeah, if you're able to be a sponsor of this event, or maybe you don't have a business, you're able to sponsor by writing a check to this. So just to be able to pitch into that, I think is
That'd be great. If you would like to, I'll give you a number. That is 386 972, that's the prefix, 7323. So the 7323 on your phone is PFCF,
oh
right?
wonderful.
So just remember 386 area code 972 and PFCF will get you a body. The body is going to be Gail Smith, and tell her you want to write her a check. And
We'll leave that number. You can find that in the link below.
yes. So yep, it's interesting you use the word quarterback, because I often think of ourselves as the quarterbacks for cancer care, right?
Right.
Because we not only just give radiation treatments, we take care of the whole process from the get-go, right? We should also talk about hospice and palliative care.
Yeah,
right?
let's do that.
So we are blessed. In Putnam County, we have 3 hospices, Haven, Community, and Vitas. They're all just as good. I'm secretly, not a big secret now that I say it on air, but plotting to rope in a palliative care physician to open shop at the cancer center.
How
So
perfect.
that'll be really cool. So he and I will, it's a he, we won't, it'll be his own practice. But the idea would be that so what is palliative care? That is the symptom management of the patient's physical, emotional, and spiritual needs. What do I mean by spiritual? So I don't know if I should say this in the air, but I come from a Christian tradition. My family have been Christians. We were converted by St. Thomas, disciple times, 2,000 years ago. But if I see a church, I run the other way, right? So I'm not a great Christian. But I know, God forbid, if somebody gives me a cancer diagnosis,
Right.
all of a sudden the
faith activated.
I'll be reactivated, right? And I'm not being jestful, it's reality.
Yeah.
So you do need some spiritual guidance. You definitely need emotional guidance.
For sure.
And you need physical, right? If you're sick all the time or having pain or can't sleep or anxious or frightened, all of these things are the symptoms of cancer. You can't breathe.
Right.
So that's what a palliative care doctor does. So there's a huge role for that, right? So I want to kind of get that into our armamentarium. So in addition to giving the patient the latest and greatest treatment, also take care of those needs.
Right.
Right? And yet they don't have to be enrolled in hospice to do that, because once you're enrolled in hospice, you can't get any of these treatments. So there is a time and place for hospice.
Okay.
Right?
So hospice is
so I want to say this carefully. I was just this week, a friend of mine who has elected not to have treatment came to me, said, "Can you be my doctor?" Because her other oncologist told her, "If you're not going to allow me to treat you, I don't want you as a patient." I thought that was kind of mean, and not a local oncologist, somebody from out of town. So I told her, "Sure, I'll see you." So she came to see me with her sister, friends of mine. "So how are you doing, so-and-so?" And as I said, she's elected not to have treatment. I've spent a long time giving her options, and she's chosen not to have it, which is fine. I can live with her decision. More importantly, she can. But she was saying, "I want to have you arrange for me to have a blood transfusion." So what for? Why? I think I'm anemic. I said, what do you mean you think? Are you short of breath? You don't look short of breath to me,
Mm-hmm.
right? So just because you think you have to put an extra layer of what's this pink stuff the ladies put on their cheeks,
Oh yeah, yeah,
right?
blush.
Blush, that doesn't mean you need that, right?
Right,
What you need is hospice. Am I ready for that? Was the next question. I said, obviously you're ready. You have a cancer. We've told you it's incurable. You've elected not to have treatment. What the heck are you waiting for,
right,
right? And so people fear that. They don't want to sign themselves onto hospice because they think that the end is near.
right,
This person may live for another year or two,
right,
right? But the advantage of getting hospice involved there, if she's elected not to have treatment, take advantage of the entire stuff hospice can give you. A nurse will show up, a doctor may show up, a social worker will show up. The whole team goes there, right?
right,
And it doesn't cost you anything, right? On the other hand, if you do need treatment, then I would discourage hospice.
right.
But why not get palliative care, right? There you're getting the best of both worlds. So that's the goal. I hope to within 6 months, you'll see a sign saying palliative care services.
We'll
That'll
have
be
to come
cool.
visit.
Yeah, yeah,
Right, we get all those services in one
yeah,
spot.
yeah.
That'd
It'll
be
be cool.
nice.
It'll be cool.
Um, I think just having a one spot to land to be able to get all that they need, and we are very fortunate to have so many services locally for that.
We do. I have to mention my partner in crime is Dr. Sullivan. He's a medical oncologist. I tell all the patients, he's the good cop, I'm the bad cop. And Vin is very pleasant, gentle, a sweet fellow. And he administers the chemotherapy. It's a completely different practice. He's associated with Florida Cancer Specialists. They are the top medical oncology group in Florida. So he has the resources behind him. Um, so we do have a good thing going in Putnam. And again, as I mentioned earlier, that we clearly don't have a lot of super specialists here, but it doesn't matter. That's the beauty of Palaca. You're in North Florida. I can send you to Mayo, UF. I can send you to Baptist MD Anderson. Geez, I can send you anywhere
Right,
where you get the best care for your particular need,
right,
right?
right,
So, and then when it's time for your treatment, after that surgery is done or whatever it is, you come back home and we'll take care of it.
right. And to that point, when we were at utilized the service at the Ronald McDonald House during my son's medical journey, and there were people who were 11 hours away from home, 20 hours away from home, to get treatment. The fact that we can be in at home and go to get the specialist treatment we need from a variety of specialists and drive home the same day
Yeah,
is
yeah.
really a blessing, and to not have to stay elsewhere, or if we did, somebody could run home and get whatever, and then to your point, once you've got all that you needed from those areas, just come back home. That is a uniqueness that we have here in Putnam County for sure.
Yes, we do. And North Florida is, I love Putnam County. It's such a laid back, beautiful place to live. People are so nice. Uh, Everything works on a handshake. Uh, Whether it is utilities, I know all my such people, but it's on a first name term, right?
Mm-hmm.
And you can call them any time of the day; they'll be there, right?
Right.
That's nice. It's unique. Um, it's only going to get better, uh, in the sense that with the new bridge,
Mm-hmm.
it's exciting. It's going to bring in a lot more interesting traffic down to
Absolutely.
Putnam, and it's all good.
Now, as our viewers have a better understanding of what it is that you do in our community and your team, and how the Putnam First Cancer Fund works, as far as, let's say we're at home and we might have concern that something's going on, what would you suggest? Are there symptoms we need to look out for? Or
So this is what I would tell people, right? You must have a primary care physician. You have to. So once you cross 40 years old, you're a silly Billy if you don't have a doctor. And the challenge is people, because cancer can sneak up on you.
hmm
And the only person who will see something is wrong is your primary care physician, who will notice that, I saw this person since the last visit has clearly lost weight. And so you have to find a primary physician. And there are still very many around. Whichever part of Putnam you live, I can find you a primary care physician. So that's important. You do have to have the annual common tests. If a woman needs to have a mammogram, men and women who have smoked needs to have a low-dose chest CT. Men should have a PSA. A colonoscopy, unfortunately, is a given, right? So those are the 4 things that you have to do. But there are certain things that there are no tests for. If you have a cancer of the lower esophagus, we don't, not only the lower esophagus, anywhere in the food pipe, we don't screen for that. If you have develop a throat cancer, we don't screen for that. But you will have symptoms that and you mention it to the primary care doctor, I have this ear pain or hurt when I swallow, or my voice has changed in its character. That's enough to alert them.
Right.
Or I've got this pain in my tongue. I think my tooth is cutting into it. Maybe so, but when he takes a look, he says, oops, there's an ulcer there, which is probably a tongue cancer, right?
Mm.
So unless you have a professional hearing you, checking you out, you're not going to know.
Right.
A good primary care doctor, excuse me, will do a skin check, because in Florida, skin cancers are rampant, right?
Right.
Nothing,
We love the sun.
and they're so curable, right? But you got to find it, so you're not going to find a spot in your back. How are you going to look at your butt, right? You can't kind of look,
Right.
crane your
Right.
head backwards, or backish, I said. But anyway, so that's the best thing you can do for yourself. Find a doctor, and it's a bit of a challenge, but an annual physical will save you, right? And do not jump between doctors. Remember, you're not marrying the doctor. You're just going there for a visit, right?
Right. Right.
Put up with the fact that you have to wait an hour to see the guy,
Right.
right? Or girl. Guys are more efficient. For a guy, it'll be half an hour.
I won't judge you for that publicly, at least.
Anyway, so you must find your own doctor. That's important. And a friend of mine had an issue earlier this week and used our hospital. And I happen to be the chief of staff of the Putnam Hospital. And I'm not sure how I got talked into that role. But
Because you don't have enough to do already.
yeah, but it's important. It needs to be done, right? So,
absolutely.
And he and his wife kept on and on about how good an experience they had. He had a problem. He had the good sense to call his primary care doctor. Again, you have to have a doctor to call, right?
Right.
Primary care doctor said, come on over right away. Send him to the ER. Immediately, the seriousness was understood. Cardiologist they did some tests. They did a cardiac cath and saved him, literally. And next day, he was discharged from the ICU, right?
Yep.
And it was mind-boggling how fast that happened. And, I hear people it's the grass is greener on the other side. I wouldn't go here because this happened to me. Yeah, sure, you could always have a bad experience, but generally we have as good a hospital as anywhere else. And remember, if you get sick, where do you think EMS is going to take you, right?
Right.
So, and it's important to find a doctor who has privileges in the hospital, right? That's exactly what happened to our friend.
Right.
He had someone who immediately picked up the phone, called the ER, and said, "This guy is on his way," and boom, 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 boom.
Yep.
It rapidly taken care of.
Right.
So, I mean, you don't have to use this hospital. Go to Flagler Hospital. Go to Middleburg. Go to Gainesville, but you must have a primary care physician.
Right.
That's very, very paramount.
Right. I think people take for granted that and since we're talking about it, having the hospital with the access that we do, to be able to be seen for an emergency. Obviously, if it's a much more life-threatening emergency, they will be able to transport you elsewhere. But a lot of the emergencies that they can handle, just having that resource.
Exactly. They life flight you. So,
Right.
HCA has spent, I would say, without exaggeration, close to $10 million easily. They're now thinking about getting a robotic to allow the surgeons to do robotic surgery. I'm sure that'll happen. So they're spending a lot of money. It's very difficult to recruit. I can't recruit technologists, let alone specialist doctors, right?
Mhm.
It's a challenge. I am already thinking about succession planning. Who exactly is going to take my place, right? And I plan to work for the next, God knows, I'm having such a great time. Don't plan to retire. Doctors typically don't retire, but at some point I got to find someone. So I'm
Miss Sheila
actually
may have something to say about that.
right. But I've actually identified a young lady who I'm actually helping her getting into a radiation oncology residency program. And I'm hoping like hell, 5 years from now, when she finishes, she'll come back home and my problems are solved.
Right.
So,
My, how the tables have turned. You really are the grumpy old man in the department with
yep,
your
yep,
underling coming in.
yep. Hardly, but
Well,
yeah.
I think that's really solid advice to have a primary care because maybe you don't need to go to the doctor frequently, but to someone that can definitively, other than your spouse, look at you in a way that your spouse isn't going to be able to order blood work or whatever that is, but to know that, hey, I see a distinct difference year over year, what's going on, and especially to your point, be able to refer you to the hospital if something kind of detrimental comes up, um, and to be connected to the other doctors.
Yeah.
And we have, for those who are concerned about the financial implications, maybe they don't have health insurance. The ASA Health here has.
I cannot say anything negative about Is Health. They're
Right.
fantastic, right? They're so good. They have, I also need to talk about physician extenders. There is a lot of good advanced nurse practitioners, PAs. These people are well trained. And when I say establish yourself with somebody, there's nothing wrong with having a nurse practitioner or a PA as your primary care provider,
Mm-hmm.
right? They are excellent. They know when they need to pick up the phone and send you to a specialist. So what's wrong with that?
Right.
You should never think that there are not enough providers to see you. ASA Health is it's a little difficult to get in to be seen,
Mm-hmm.
right? And I would say my guess would be if you call for an appointment, it may take up to 3 to 4 weeks to get in. But that's good enough. You're okay. You're just
Right. It's not an
establishing it's not an
emergency. You're
emergency, right?
doing every year. You know it's coming.
What you should not be doing is using the ER as your primary care place, right? Because ERs, and that's a misconception people have. So because they're not well off financially, they don't go to doctors, so they use the ER. And then they'll complain that, I went to the ER 10 times for this problem. Well, the ER is only making sure that you're not being shot,
right,
or not had a stab wound, or not had a fractured your skull or something like that, right?
Right.
Anything else, they're going to blow off. They're going to say, go see your primary care.
Exactly.
And you don't go see your primary care. So you go back, every time you go back there, that's all they will do.
Yeah.
Right? That's all they're supposed to do. So you're not doing yourself a favor to go to an ER for silly-billy stuff.
Right. Right. Yeah, like I have a runny nose. I need to go over there. So, well, that's really, really good advice. I have thoroughly enjoyed the wisdom that you shared with everything, and I think it's wisdom. Yeah, I learned some things along the way. And I won't take offense to the fact that women doctors take longer to see you than men. We're taking care of the emotional needs too.
Women doctors are fantastic, right? So don't misunderstand me. In medical school, clearly, the women doctors are smarter, work harder, and the men doctors are flakes. Right?
You said redemption.
Yeah. No question.
No, I think it was. I got you, Jay.
Half teasing.
No, I get it. We like to chat, which is why you have a female podcast host here. Honestly,
there you go.
But I really do appreciate the wisdom that you've shared, and again the fact that from California, you've made your way here and brought all your experiences, and I'm thankful that you made your way to England to impress the California doctor over there. And but I think that you have brought so much to this community and brought together so many people in this community, and I look forward to you not retiring. At least let me get through my age, and then you can retire.
Yes, ma'am. Got it.
But congratulations. I can't wait to see what happens in the future. We'll have to come out and do a Dr. K update, and maybe we'll come check out the gala and see what that's all about and share with our viewers.
Yes,
That'd
please
be
come.
fun.
It's called Denim and Diamonds, and I want to say it's November 8th. I think I got that right. And if
we'll correct you if not.
Yeah. In fact, it's November 8th, and I think the golf tournament is October 12th. So,
November 8th and October 12th. We'll link below. You can look at some of the past ones, or if we've got links to the future ones, we'll find those and put them below. And those are ways that you can support. We've got the phone number below if you want to support. But take care of yourselves, people. Be sure that you find a primary care, whether it's here or somewhere else. We just want you to be healthy. And if you ever feel like, heaven forbid, you're in a position where you got to see somebody for oncology, we got the perfect guy right here sitting in our very own hometown. So thank you for your time this morning.
Thank you for having me.
Oh, it's my pleasure. And we'll see you guys on the next episode.
Bye all.